Um, and this is just mostly for the media, just so you're aware of this. Because the governor, the Department of Health, and Salt Lake County have all issued statements concerning Dr. Dunn's new role, her focus here today is going to be on the state's response to COVID-19 pandemic. And so she's asked me to relay that she will not be entertaining questions about her decision to accept the position of executive director of the Salt Lake County Health Department. So just so you guys are aware of that, we're really focused on the COVID response. So our speakers today include Governor Cox, Lieutenant Governor Henderson, and Dr. Dunn, and we'll turn it over to Governor Cox.
Thank you, Joe. And while Dr. Dunn may not be taking any questions about her leaving, I'm happy to take questions about her leaving. And we're so excited for her and so sad for us. This is a great promotion for her, and she's going to be with us for a couple more weeks. So we'll have much more to say about her and how sad we are that she's going elsewhere, but how excited we are for this next adventure for her. So I'm excited to talk a little bit more about where we are today. The good news will be if these briefings get boring for you and for our media partners, we can't wait to not have anything to talk about as we continue to progress in the fight against the coronavirus. We're going to be sharing a lot of numbers with you again today, and but there's something we really hope that people will get out of this setting and these briefings. Of the Utah, well, let me back up. We reported yesterday that more than 800,000 Utahns are now fully immunized against COVID-19. That's more than a quarter of all Utahns, and of those eligible, I think adults were now above 50% with at least the first shot. Really excited to report that 86% of people 65 and older have received at least one dose, and 74% of those 65 and older are fully vaccinated. If you go to 70 and older, that number is 77% that are fully vaccinated. We also expect today that somewhere in the state of Utah, some lucky person will receive the 2 millionth dose. That's combined first and second doses. And I hope that, again, what we're conveying here is that so many of you are getting vaccinated, and that the vaccines are safe, and that the vaccines are effective. For those of you who have not been vaccinated, we know there are some people that just will refuse to get vaccinated. There's another group that's hesitant and trying to decide whether or not to get vaccinated. There's also a third group we haven't talked much about, and those are kind of the vaccine casual. They want to get vaccinated, but they're kind of waiting to make sure that other people have been able to get their vaccinations first. To all of you, I want to say that now is your time. We're ready for you. We have ample doses. I've talked to lots of governors across the state. We're starting to cross that threshold between where we've been, demand has outweighed supply. Now supply is starting to outweigh demand a little bit, and so we have lots of demand in almost all of our counties. Salt Lake County is still booked, but we're moving doses here so that we can deal with that demand here. And now is the time. We want you there. There are lots of appointments available, and the Lieutenant Governor is going to talk about some of the things we're doing to make vaccines more convenient for people, getting them where you are, and in places where you can receive them more easily. And that's the transition that we'll start to make now. We've been really focused on the mass vaccination sites, getting as many people in as we can. Now, with enough supply, we'll start to focus more on regional, local, community-oriented vaccine sites, work sites, and schools and other places where people can go and get vaccinated. So we're excited to start to make that change. I will also say we're very excited. I think yesterday we moved up to, I think we were 4th in the nation for the percentage of vaccines in arms, and again, just that's a tribute to the great work of so many people. in our state. Now, the transmission index, as Dr. Dunn will share the numbers a little bit later, we're in a plateau right now, a clear plateau. We had, for example, we had about, I think, 40 cases fewer on Tuesday. Then we had an increase Tuesday versus Tuesday of last week. On Wednesday, we saw an increase of about 50 or 60 cases. And then today, I think there, about 15, if I saw the numbers right, an increase. So we're definitely in a plateau, and we're seeing that in some of our counties. We have a couple counties that have moved down in the transmission index, which is a positive thing. So carbon and severe counties have moved from moderate to low transmission, which is great news. That means we have 13 counties now in low transmission, which is just fantastic. We've had 2 counties that have gone the other direction. We have Washington County that has gone from low to moderate, and we have 15 counties in that moderate transmission index, and then Grand County has nudged back into the high transmission area, and so they're the only county there. So this is just a reminder again that the pandemic is not over, although we are getting closer, and over the next few weeks, as more and more people achieve that fully vaccinated status, we'll have great protection, and we hope and expect those numbers to start to come down. We have seen increases in other states in the nation. It looks like the national numbers are starting to decrease a little bit again, which is great. So we didn't see the surge that everybody was worried about, with the exception of a couple states. But we're hopeful that we can start to drive those numbers back down. Now, I want to announce right now that we have our 2021 Impacted Small Business Catalyst grants available for those small businesses that were severely impacted in the state of Utah. And let me give you just some of the details about this. These are for small businesses that were hardest hit during the pandemic. And we have $15 million that has been set aside for these small businesses, nonprofits, and organizations that were highly impacted. And that's defined by organizations that experienced a 90% or greater revenue loss when comparing any 4 months of 2019 to any of the same 4 months in 2020. So if we can see, again, that serious, severe economic downturn. As of yesterday, GoEd had received about 300 applications. However, only about 68 of those applications met that 90% revenue loss threshold. Applications are available until April 27th at 5 p.m. And you can go to coronavirus.utah.gov/business to apply. We encourage all of those severely impacted businesses to apply for that grant, as we know that this will be something that is very helpful to keep those doors open as business starts to come back and as life gets back to normal. So with that, I'm happy to turn the microphone over to Lieutenant Governor Henderson, who will talk more about our vaccination efforts and increasing those local communities, as well as the equity piece of vaccines. Lieutenant Governor.
Thank you, Governor. Good morning. I've got a bunch of numbers to give, and as the Governor mentioned, we'll give a bit of an update on vaccine equity. As of today, we have administered 1,985,296 doses of vaccine, a daily increase over yesterday of 34,402 doses. A week ago today, our total doses administered was 1,808,824. These numbers are first and second doses, and this is a weekly increase of 176,472 doses. Half of all adults in the United States have had at least one dose of vaccine. In Utah, as the governor mentioned, we're at nearly 52% of eligible people in Utah have gotten at least one dose, which is really good news. But we have a lot of room for improvement, and we encourage everyone to not put it off. If you want to get a vaccine, please sign up and go ahead and get one. We're making some significant progress in the area of equity, and we've talked a lot about vaccine equity. And this really just means that we want everybody in our state, the percentage of doses administered to all the different portions and groups in our state to roughly mirror actually our population. And we have a little bit of work to do here. Actually, we've got a lot of work to do here, but we've also done a lot of work. And I'm going to give you some numbers. So since March, we have really put in a lot of effort into making sure that our multicultural communities have access to vaccine. We've talked a lot about access. Just because a person is eligible and a vaccine is available does not mean that a person has access. So we have really been trying to focus on this access question and breaking down whatever barriers are in the way that are preventing people from actually getting a dose of vaccine administered to them. And there are a lot of different types of barriers. I'm going to talk a little bit about our multicultural communities. Right now, 37% of Asian adults in Utah have received at least one dose of vaccine. 28.8% of Hispanic adults have received at least one dose. And 19.8% of Black adults have received at least one dose. Now, to put all of this into perspective, and we're doing better than we were now that we've been focusing on this, but to put it into perspective, 47% of white adults have received at least one dose of vaccine. So you can see where that equity comes into play and why we're focusing on that. We want to make sure that our doses administered really, truly do reflect the population of the state. And we've also, there are other pieces of this equity piece that we're focusing on: rural communities, frontier communities, long-term care facilities, homebound individuals. These are all groups of people that we are focusing on making sure they have access to the vaccine. Now that more than 75% of our most vulnerable Utahns, this is those 65 and older, more than 75% of them have been vaccinated, we are really starting to turn our focus on reaching those who are 16 and 17 years old in our schools before school gets out. Now, it's really important to note that parents have to give permission for their students to get a vaccine. The students aren't going to give vaccines with against the parents' wishes. So schools are working hard to make sure that they have that permission, but we are trying to reach into schools to make it easy for these young adults, these teenagers, to get vaccinated. And this is really a key component to making sure that we can all get back to school in the fall and do so safely and hopefully normally. Also, we're going to start working very closely with colleges and universities to reach those students in our population and make sure that they have access to vaccines. We've had, this week, Snow College had a mobile clinic on their Ephraim campus, and we're starting to see more and more schools, universities, and colleges focus on these efforts. Mobile clinics continue to reach out to hard-to-reach populations around the state. Yesterday, Summit County Health Department held a vaccine clinic for Park City service workers. People who work at restaurants, retail, and related industries had a walk-in style clinic where they could just stop in and receive their shot. In industries where taking work off is difficult, this is where our schedules aren't necessarily as flexible. These types of clinics can really help provide access to vaccines for people. And then there's one other thing I want to point out. Lyft, people who need transportation can now take Lyft to their scheduled COVID-19 appointments. We talked a few weeks ago about UTA doing this as well. Now people can actually get a ride from Lyft to their COVID-19 vaccination appointments at no cost to them. And this is really an effort to try to, again, reach those underserved people who may have difficulty. One of the barriers may be transportation, getting to their appointment. And this really was made possible by a donation from Regions Blue Cross Blue Shield of Utah. They donated $250,000 to United Way Worldwide and United Way Salt Lake in order to reach, we've got 9 counties right now, Box Elder, Davis, Salt Lake, Tooele, Uinta, Utah, Wasatch, Washington, and Weber counties are participating in this program. And people can easily arrange their round-trip Lyft rides to their scheduled appointments by calling 211 or visiting 211utah.org. Thank you. Now we'll hear from Dr. Angela Dunn.
Good morning. So before I start with my usual update, I do want to briefly address the media stories that surrounded my decision to accept the position as Executive Director of the Salt Lake County Health Department. I was not fired from my current position. This was a choice. And until I make that transition, my focus is solely on continuing to help inform the COVID-19 statewide response here in Utah. And because this is my focus, I will continue, of course, to take questions from the media about the state's COVID-19 response, but prefer to delay any questions about the transition of my job. So moving on to our numbers for today, the 7-day average of new cases is now at 386. That is down from 390 from this time last week. And our percent positivity is also down. Person over person is now at 6.6%. Last week it was at 7.4%, and test over test is at 3%. Last week it was 3.7%. And I want to reiterate and reinforce all the things that Governor Cox and Lieutenant Governor Henderson have said. We have heard from vaccine providers that demand for COVID-19 vaccine is starting to soften, and this is not totally unexpected. We've administered nearly 2 million vaccines, which represents over 800,000 Utahns being fully vaccinated against COVID-19. These were individuals who were very eager and ready to get the COVID-19 vaccine. So now we're starting to work into those populations who might have some hesitancy or are just taking their time to get vaccinated. So if you fall into the group of still having concerns and questions about the COVID-19 vaccine, I encourage you to reach out to your healthcare provider, your local pharmacist, or friends, family, coworkers who have already gotten the COVID-19 vaccine. Get that information for yourself from trusted sources. For those of you taking your time, now is the time to get vaccinated. There are plenty of doses and appointments out there for you to get your COVID-19 vaccine. Hundreds of providers across the state are giving vaccine right now. So make your appointment today, and this will help keep yourself, your family, your loved ones protected against COVID-19, because this is the way we're going to end the pandemic. Thank you.
Thank you, Dr. Dunn, for clarifying that I did not fire you. I appreciate that. In fact, I told her today that I had made an executive order that she could not leave. So I just undid whatever it was that she was trying to do there. But I don't think I have the authority to do that. So, okay, ladies and gentlemen, I'm happy to take any questions, or any of us will take questions.
Hi, I have a question for Dr. Dunn, if that's all right.
Yep.
This is Sonia Hudson with KWR.
Go ahead.
So Governor Cox mentioned at the beginning of the press conference that we're kind of in a plateau. Can you talk about where we are in terms of declining and plateauing cases, and what, if any, impact the ending of the state mask mandate has had on that?
Sure. So we've been in a plateau for a little bit now. But the good news is a lot of the country has been in an increase and just now started to get into a plateau. So we've been really holding off that additional surge. And it's because of, one, of course, the individual actions we're all taking, like wearing masks and social distancing, but also our really rapid uptake of vaccines throughout the state is holding off that surge. So the plateau is really good news, but what's even better news is that our percent positivity is decreasing, which shows that we should start seeing a decline in our cases in the coming days and weeks, because people out there getting tested are tending not to have COVID, which is fantastic. We haven't seen any dramatic or really obvious impact of ending the mask mandate on April 10th to our cases and the spread of COVID. I will say that, from just observing and being out there, people are still tending to wear masks if they choose, which is fantastic. And I encourage individuals, if you're in a crowded situation, especially indoors, to continue that practice. We are almost there. And our vaccines and, of course, our individual behaviors are fending off that additional surge we might see.
Thank you.
Sorry, can you hear me?
There we go.
There we go. Okay, I was going to ask, I'm not sure if this is for Dr. Dunn or the governor, but in order for the state to reach herd immunity, will some of those who are vaccine hesitant or casual, as the governor said, need to get vaccinated? And does the state have any plans to try to make those people comfortable getting a shot?
You know, herd immunity is this kind of like vague goal. We are shooting for 70% because that's where the data shows us that might be herd immunity for COVID, but we really don't know. But every individual who gets vaccinated against COVID is preventing the spread of COVID and helping us reach the end of the pandemic. And so, of course, when we're looking at our vaccine hesitant or people who are slowly going to get vaccinated, we need them to get vaccinated. We're seeing that decline in demand. And in order to really reach the populations that might have more questions or concerns, we're going to, eventually shift our strategy away from mass vaccinations, keep some of them open for those who are comfortable going there, but really allow vaccines to be in the hands of providers so people can ask the questions at the point of care and become comfortable. So we have those strategies in place. We haven't needed to implement them yet because we still have appointments filling up at our mass vaccination site. So we need to keep those going because you get a lot of speed there. But yes, over time, we have that plan to transition away from that. I will also say a big piece of our vaccination strategy is also getting mobile vaccine teams out into the community, into places where people are usually going so that they have easy access to vaccine if they can't make it to a mass vac site.
Next question.
Hi, this is Ben Winslow with Fox 13. It's a question for Governor Cox. This morning, the legislature's Administrative Rules Committee explored whether to lift the mask mandate for K through 12 schools. So my questions are, will you be lifting it? And if state health orders are going to be terminating anyway in the next 2 to 3 weeks under the endgame law, does it lift that anyway?
So Ben, if you look at that law, it does not. It specifically keeps those in place until July 1st, I believe. But this is something that we're constantly reevaluating and constantly looking at. And again, I think we would all love all of the mandates to go away as quickly as possible. One of the big concerns, and we've said this many times, is we want to keep kids in school. That's the goal. That's the most important goal. And by the way, Utah has done that better than any other state. We have kept our kids in school, with the exception of one district. Kids have been in school since last fall when the school year started, and so that's really good news. And the problem is if we do have outbreaks in school, and there are still some outbreaks happening in some schools, then if kids don't have masks on, then they have to miss school for a couple weeks, and that's what we don't want to happen. And so we desperately want to keep kids in school. We're so close to the end of the year, and so we're all working closely together. But again, we will continue to reevaluate that, see where we are, see where cases are, and make those decisions as we draw closer to the end of the year.
Hello, this is a question for Dr. Dunn. It's Sean Means from the Salt Lake Tribune. When we're talking about the plateauing of new cases, we're leveling off around 375 a day or so in that ballpark, which is about where we were back in August before the fall surge. In some counties like Davis County, Wasatch County, Weber, Morgan, they've actually been going up in the last couple of weeks. Is there any explanation for why those counties are on the increase, and what can the state, what can those counties, what can residents do to bring it back down?
Yeah, we can't, those increases in the specific counties, we haven't been able to identify any specific source that's contributing to the increase in cases. I will say that it's just, the same tried and true recommendations moving forward is, of course, number one, get your vaccine. If you're 16 and over, go get that. That's going to prevent another increase. But then if you're out and about and it's crowded make sure you're wearing a mask and physical distancing as much as possible. We have seen an increase in the variants or the different strains of COVID-19. About 50% of our cases now are estimated to be due to B.1.1.7, which is the UK variant. And that is easier to transmit. It's easier to spread. And so it makes it even more important for us to get vaccinated as soon as possible because it's quicker. The increase in spread of cases is quicker right now. So the same recommendations apply. We can't point to any one specific instance other than just community spread in the variants.
Good morning, Governor. This is Jacob Kloffenstein with KSL.com. I wanted to ask about the Johnson & Johnson vaccine pause and what the latest is there. Have you heard anything from the federal agencies about when that might be lifted or any other updates? And then obviously, since that vaccine has been a big part of the equitability process, getting that into the frontier communities and that type of thing, how has that changed the state's vaccination strategy during the pause?
Yeah, thanks, Jake. So the last conversation we had was on Tuesday with the federal government, and we think there's a chance that Friday or Saturday of this week that we could see a potential change there. We know that those meetings are happening and that reevaluation will happen. I believe Dr. Fauci mentioned that it was his hope that could be taken care of by Friday or Saturday. I don't know that we have any additional information. I don't think we do beyond that. So what I would say is look for a decision in the next 24 to 48 hours. Look, there is no question that this has impacted the national effort when it comes to equity and getting these harder to reach places, geographical places, and harder to reach people. A great example of this is our college students. Many of our colleges had planned to use the Johnson & Johnson vaccine to get students vaccinated before they leave for the summer, because it gets a little harder if you have to do 2 doses, one there, and now you'll have to find somewhere else to get that done when you're out of school for the summer, and that didn't happen. So that clearly has impacted things. We have substituted Pfizer for the Johnson & Johnson wherever we can, since we have a little more of that than we do Moderna, and we're still doing very well. We have lots of supply, but we're really hopeful that we'll get the Johnson & Johnson vaccine back, and that we won't have lost too many to vaccine hesitancy because of that pause. Last question.
Thank you. And Governor, this is Chris Reed, St. George News. We mentioned about Washington County moving from low back to moderate. One of the things in moderate, according to the stipulations, is that gyms, which have just basically fully reopened up, fitness centers, have to go back to moving all their equipment and space them, have to have people spaced. In that aspect, I mean, going back from low to moderate, do we expect all these fitness centers to comply with that? And I guess as a second question, what is your message to Washington County? Is this COVID fatigue? What should people in Washington County do to get back to low?
So thank you, Chris, for the question. Under the guidelines that have been put out through the transmission index, that's just a recommendation in moderate. That is not a requirement in moderate. And so, look, again, this is where we encourage people, as Dr. Dunn has just said, to still take it seriously. And if you haven't been vaccinated, get vaccinated. If you're vulnerable, be careful in those situations, right? You're going to have to make those decisions that are best for you. And that's where I think it's important. We've talked a lot about what to do to be safe, and where to wear masks, when to wear masks, and all of those things. But I think sometimes we also forget kind of the other side of this, that there are certain places where it is really safe. And Dr. Dunn and I had a conversation about this yesterday. If you're outside and you're not in large groups kind of clumped together, you don't need to wear a mask. The data around this is also very clear that there have been very, very, very few documented cases of transmission where people are outside kind of doing their thing. So you don't need to worry about that. Now, she recommended if you're in like a concert where people are packed in side by side outside, then there still is a risk of transmission. But outside is a great place to be, and there's no better place to be outside right now than Washington County. So that's what we recommend. I know the League of Cities and Towns is holding their conference down there right now. I believe I saw some pictures. They're out at Tuacahn this morning. They had a speaker out there. They're outside. Great place. You know, you're not packed in. You don't need to wear a mask there. So again, some common sense, I think, is what we're really talking about, and getting vaccines and driving those numbers down is what we're looking for. I don't think, as she mentioned, there's nothing in any of the counties that is of concern other than just the normal movement of the virus. The UK variant, we do know spreads a little more quickly, as she mentioned, and that's certainly part of it. And so this is kind of just the normal fluctuation of a plateau. We've got some counties coming down a little bit, some counties going up a little bit, but we're as more and more people get vaccinated every day, we hope to drive those numbers down. And with that, we hope you all have a wonderful rest of the week and a wonderful weekend. Again, we look forward to running out of questions in these daily briefings, and but until then, we'll plan on seeing you again next week. Thanks, everyone.
Okay, thank you, Governor Cox. This concludes. Our next briefing is scheduled for Thursday, April 29th at the same time. So thank you to all our media partners and all our interpreters.
Good job, everybody. You're all the best. I don't know if we can say that enough. Thank you for showing up.